Good afternoon, everyone. It's an honor to be here. I want to thank the men's group. It's Kingsmen, right?
Yes.
Kingsmen. Okay, and Brother Oluyode. Oh, your body. Sorry, Brother your body. I appreciate your organizing this, and of course Otumba for the house for hosting, and my dear brother Otumba. Thank you for hosting. Well, we've sampled the pepper soup, so we know that the rest is going to be fantastic as well. Thank you very much, and of course, my dear brother Bimbo, who pushed to make this happen. Thank you so much. So this is I'm very passionate about this. I'll tell you a little bit about myself, but we're talking about brain health, mental health especially. Um, but Bimbo talked about faith and walking by faith. I think that's extremely important to mental health and to brain health. There's no question about it. Scientifically, it has been proven that people who are more quote unquote religious, who attend services more, who have a deeper faith in God, tend to do better mental health wise than people who do not. This whole thing about atheism is really anti humanity. We are designed, we are built to have to have a dependence on a higher power. That is biological. It's built into us. So it's very important that we know how to do that, and that we stay true to what we know to be the true way, which is the Christian faith. However, it is not enough to just have faith, because as we all know, we know giants in the faith who have fallen ill and died before their time. And that's because there's more to the picture than that, which is why I believe it was in Peter, 2 Peter, that says that add to your faith what? I believe somewhere along the line it says knowledge and a few other things. So this is what we're here to talk about, knowledge, especially knowledge with regards to the Black community. And it's a tragedy that what I see among healthcare professionals is that we tend to just look at everything the same way, blacks and whites. As a matter of fact, I was at a conference yesterday, which was specifically for Black. It was a dementia conference specifically for Black, and there was this expert professor. She's brilliant. She's done all the research papers, very well known, very well cited. And she was talking about some of the reasons why Blacks have it worse. As you know, we are at least twice. Some people say as much as 4 times as likely to have dementia as white people are. This is not a conspiracy. This is a fact, right? They're not out to get us. This is a fact. But what disappointed me the most was that she said we are blacks and whites we're the same. It's just our environments, and by this she meant racism and a few other things. So our environments that make us more prone to it. Yes, racism plays a role. It is not the only role, because all over the world, memory issues, brain issues are exploding. And it's not all over the world, including Nigeria, which, by the way, has the most number of Black people on the planet, as you all know. You cannot attribute that to racism, can you? Yeah. So it makes no sense. But that's all they talk about. That's all they talk about. So I want you to listen carefully. If you have any notes, this is a small group, so if you have a quick question, I can quickly answer it. If not, we'll just wait until the end. How's that? All right. Thank you. Thank you again for having me. So this is quite an overview of what we'll be talking about, and we'll get to it. The Alzheimer's Association is a wonderful organization. So they have a lot of resources, whether it's legal or financial. In most of my presentations, I always recommend them. I volunteered with them for a whole year. And so they do a lot of good work. So if you have anybody that is struggling with that, that's a good resource to have. That whole thing about that story, I'll probably get to that later on. But I run the Brain and Body Foundation. It's based in Nigeria and the US. And we do a lot with regards to, please, what time is it? So I can just be sure I'm keeping time. What time is it now and how long do I have? 7 minutes to 4. 13 minutes more. Thank you. So I'm going to have to rush through a lot. So please give me like a 10 minutes warning and a 5-minute warning. Okay. All right. So we established the Brain and Body Foundation about 2015. And the whole idea was that in Nigeria, as well as in many African countries, there are brain disorders and there's pretty much not much treatment. And it happens mainly among the poor, and so children especially have brain damage, cerebral palsy, and so on and so forth because they don't have access to healthcare. So we decided to figure out how to address brain conditions within the context of the Nigerian environment, the poorest of the poor. And so we found out that there were simple things you could do if you knew what to do to address things like cerebral palsy, autism, strokes, and sickle cell disease, and so on. And eventually, we started having adults coming to us with brain disorders, like dementia. At that time, we were told that dementia is probably it's impossible to prevent, it's impossible to treat, and that's because it came from the Western world. We were being trained as doctors that there is no cure or prevention or treatment or even slowing down of the disease. That is not true anymore, because if you understand basic fundamental, the brain is like the rest of the body. There are things, it obeys certain laws, and if you apply those laws, things will get better. It doesn't matter how bad it is, things will improve if you know what to do. And we found out that there's a lot that can be done. I'm also very passionate about teaching, so we started it on NTA. We've been going on 6 years in this November, where we were educating people around Nigeria, and NTA, of course, broadcast to Africa. So we spread our message to Africa. We won the award for best TV station in Africa about a few years ago. In Baltimore too, because I teach a lot. I do a lot of presentations. I also was awarded what you call it now, Baltimore Game Changer magazine edition, and also for some reason I've not been in Nigeria for 4 years, but they gave me the most respected health CEO in Africa for, I guess, the work that I've been doing. So the point is not to impress, but to impress upon you the fact that this is my passion, and I think there's a huge gap when it comes to knowledge especially about brain health, but more importantly about brain health among the African American community. It is shocking what you're not being told, what most people are not being told. Shocking. These are the other areas I discuss. All right, so let me just, since we have very little time, this is what we're trying to prevent. The normal brain, the Alzheimer's disease brain, is about 2/3. So you've lost about 1/3 of your brain tissue by the time, not you, hello, my dear. But by the time an individual has advanced dementia, he has lost 1/3 of their brain. That is a lot. Somebody say a lot. A lot of computing power that is gone. There's another picture there. And early signs. Some people just think it's all about memory. It's not just about memory. It could be things like mood changes, behavioral changes. A lady was telling me that the way they found out about her mom, she went to help her mom pack. I think her mom was traveling, and they were putting the clothes into the luggage. And then at a certain point, the mother took the clothes, and then she didn't know what to do. Yeah, she took it back. And it was like she was just confused. So it could be things like just process tasks, sequential tasks. You may just miss it, and you not know what to do. It has a lot to do with the way the brain cells are communicating in the brain. We don't have time to go into that now, but it's all about the synapse. Has anybody heard that before? The synapse, the connection between two brain cells. That's really what is going on when it comes to anything, whether it's memory loss, dementia, Parkinson's disease, even strokes. It comes down to that basic thing. Like I said, we don't have much time to go through it, but let's talk about what makes a good brain go bad. And I love this definition because it talks about the underlying factor. It says dementia or Alzheimer's disease is a degenerative brain disease that is caused by complex brain changes. And there's the key: following cell damage. It's not something that just springs on you from the bushes and ambushes you and tackles you down, which is kind of like what we've been told. It's like a sniper that you don't know when your time is up. You just pick you unawares and you're gone, and then it's like a long process. There's a process to it. Now, and I've been treating people with dementia now for quite a few years, and I've seen when you really get down to it, you really see the process, the things that went wrong, the things that they should have done that they didn't do, the things that they did that they shouldn't have done. It's over 95%, my dear friends. Over 95% is really what you should have known to do that you didn't do, or the things that you shouldn't have done that has eventually caused brain damage, which eventually sets up a sequence, a chain reaction that leads to the demise of your brain. And so I really want to impress that upon you. There's a lot of things that you can do. All right. So this is a little graphic that kind of gives the process: cell damage, complex brain changes, degeneration, and of course symptoms. And so when I started seeing this, I started thinking about it. And again, because of the fact that I teach and the fact that I practice and I treat, I decided, okay, let's start figuring out what are the things. So we came up, so I have a talk called Dementia's Dirty Dozen, where it has about 12 sort of, so to speak, pathways that lead to the disease. And they all start with the letter I. I had to try and figure that out. And so we talk about, in some cases I kind of finagled a few things, but eventually we came up with 12. And each one takes a long time. So I'm just going to hop on 2: illnesses and insufficiencies. Everybody say insufficiencies. Everybody say illnesses. Okay. There are certain illnesses that make an individual more prone to getting dementia. And some of those illnesses have a preponderance in the African American community. So let's talk about that. One of the most important things, again, that is not emphasized like it should, is I believe, is cardiovascular disease. There's blood vessels. Some statistics about African Americans: we have twofold risk of strokes. Hypertension and diabetes are highlighted because they are the most, in my opinion, the most common. It's like a rite of passage when you turn. Is it 14 or is it 50? It's like a rite of passage. My friend who is a stroke doctor in the UK says, Dayo, are you on your amlodipine? That you should be on 10 milligrams amlodipine. This bagger, I not even found out what my health was or anything like that. Are you on it? He's like, yeah, are you on it? I just there was no question of, have you tested? Have you done this? Have you done this? Are you on your amlodipine? Hello, sir. You're welcome. You're welcome.
Hello, guys.
We have the minute to yours. Sir? Oh, I didn't mean it. Okay, thank you. Thank you very much. Okay, thank you. Thank you. Oh, fantastic. Fantastic. No problem. No problem. So as I was saying, the whole idea. Yeah, welcome, sirs. Welcome. So he just assumed, this my friend just assumed that because he's a stroke doctor, he has seen it over and over again in the UK. It's like black people are more prone to this thing. And don't take chances, just go ahead and take your full dose of amlodipine. At that time, and he was right. I was on amlodipine. And I was struggling between 5 milligrams and 10 milligrams double dose. Because I was like, okay, because everything has a side effects, and I wanted to find a way to minimize it. But he was right. He was right. So it's assumed that most people will be dealing with some kind of cardiovascular disease. By the way, so I was attending a conference one day, and these are histopathologists. They looked at the brains. They looked at the brains of people with dementia. And what the histopathologist is the one that looked at the dead tissue, right? And what he said was that he has seen brains of people who have died, who had what is known as the amyloid plaques. And does anybody know what that is? That's the protein things, the plaques in the brain that they say cause dementia. He says he has seen lots of brains. Yes, sir. Sorry. Blood pressure medication. It's probably the most common blood pressure medication. I think it's a calcium channel blocker. Most common for African Americans. That's the one that works the best. There's a totally different kind that works for white people. You don't want to mix them up because we've actually seen people who died because they were being treated as if they were white. So blacks were very different biologically. And I don't know why people keep on saying that we're the same. We're not. So he said that he has seen lots of brains of people who died with the amyloid plaques. They didn't have dementia. He has seen lots of brains of people who had both the amyloid plaques and there's another thing called tau tangles, which have been related to dementia. So they've seen them with tau tangles and tau tacs that died. They had no signs of cognitive deficits. He said he has never, everybody say never seen the brains of people who died that had amyloid plaques, maybe tau tangles, but had evidence of cardiovascular disease. That means like hypertension or damage to the blood vessels in the brain for whatever reason. And it may not even have shown, it may not have had an actual stroke. It may just be that the vessels are diseased. And you can have at least 70% of your blood vessel blocked and there'll be no sign. So what he's saying is that it's really, in the final analysis, is the disease of the blood vessels, whether it shows symptoms or not, that eventually leads to what is known as dementia. And that makes sense because the blood vessels are what supply the brain cells with the nutrition and the oxygen the brain needs to work. If that is compromised in any way, you're just not going, your brain is not, there's going to be dysfunction, there's going to be damage, and eventually there's going to be death. Does that make sense? The brain needs over 20 to 25% of the entire energy supply of the body. So think about it. Your brain is tiny. It's like 2% of your body's entire weight. It requires 20 to 25%. 25% when it's fully maximum, working really hard, right? 20% when it's at rest. It requires that of the glucose, of the oxygen, of the amino acids, whatever it needs. It's an energy hawk. So again, once you're compromising that blood flow to the brain, bad things will happen. And the things that compromise blood flow to the brain are things like hypertension, chronic high blood sugar. It may not even be diabetes yet. You may just be having high blood sugar. And another thing is called insulin resistance. And guess who has that the most? Exactly. All right. So let's go on a little bit more. What I've decided to do, because I really want to narrow things down and just really make sure that I hit on the most important points. The three things that make us a little bit more prone. And by the way, I'll have my staff kind of put the slides together and all that. So if you let out my information, you can send me an email or a text, and I'll send it to you individually. I'll have them maybe on Tuesday, so of the slides. But the things that make us more prone to things like hypertension and diabetes, there are three main things. One, increased calcium sensitivity, which is why things like amlodipine, by the way, blocks calcium. That's why it's called a calcium blocker. We are more sensitive to calcium levels than white people are. We are also more sensitive to salt than white people are. The salt is what kind of like makes us more hypertensive. And number three, we tend to not be able to handle sugar as well as white people do. But here's the problem: we tend to like sugar a lot more than white people do. I would like pepper too, but pepper is not a problem. But we know the calcium, salt, and sugar are a problem. So I'm just going to talk about a few things So these are things that all increase. Yes, which one? All right. So salt sensitivity, sugar sensitivity. I think are we all familiar with the fact that we're more prone? We have salt sensitivity, right? Yeah, that's why the drugs they give for us have to do with. So you have what they call it in Yoruba, the ones that make you pee out, they make you pee more. Diuretics, exactly. So diuretics work better for us. Calcium channel blockers work better for us because again, we are more sensitive to calcium. By the way, you should not be taking calcium supplements. Do not take calcium supplements. One of the reasons for that is that calcium, again, because we're more sensitive to it, it tends to build up in our blood vessels more easily. Okay, the fact that you take a supplement that has calcium in it does not mean that it's going directly to the bones. Yeah, it's basically going into the blood. It's not going into the bones. You need something else to push it into the bones, and we'll talk about that. But do not take calcium supplements. You don't need to. All right. Yeah. Avoid it. Stay away from it. Yeah, you can take whole milk. You don't need the extra calcium. What? All right. So sugar sensitivity. Let's talk about sugar sensitivity real quick. I put a picture of a teaspoon there for you. That is the amount of sugar that your body is comfortable with after a meal. So after a meal, let's say like 2 hours after a meal, the body is going to do everything it can, raise insulin to push the sugar into the muscles, into the bones, into the brain where it's needed. The body does not like anything more than 4 grams of sugar in the blood. Okay. Do you know how much gram of sugar what's that? Correct. That's 4 grams. That's what's in a slice of bread. One slice of bread. One slice. That's right.
One loaf.
Yes. That does not include the burger and the fries and everything else. All right. No. So your body is a very efficient. Your body tries to bring it all down. That's the whole point I'm trying to bring up. Now, the younger you are, like this young man who just walked in, we don't have to worry talking to him about it because their body is chassis. Their bodies are working well, so they bring it down. Brand new, yeah, But over time, I'm changed. So, and the processed food is a big problem there. So you have all these things. I mean, doesn't your mouth just water just looking at this thing? Yeah. So this is a lot. And then we love the drinks as well, right? So listen, I'm not here to bring you bad news. I'm just trying to present you with the facts as we see them and tell you. But we are being targeted. That's the truth. The marketing companies, they know that we cannot control ourselves when it comes to sugar, and it's dirt cheap. So we are being systematically targeted by the food companies. They know that black people, they're a good market to go for. All right. But it's not just about the black food. I mean, look at this now. Doesn't that look good? So I'm from Ikiti. This is me. This is my food right here. So pounded yam and all that. It has this has a lot of sugar. This has a lot of sugar. Pounded yam. It converts to sugar so rapidly. Yes, sir. And even amala may be a better substitute and all that. But the whole idea is we want to start thinking about reducing. I mean, what you are eating when you are 18 is not the same thing you should be. Come on, you should not be eating the same thing you are eating when you are 18 at this stage. Because one, your body is less effective and efficient at processing foods. Number two, you are certainly not as active as you were when you are. Everything has settled down now.
Does it help when you're
active?
More active, yeah.
Like playing tennis, you mean?
Exercise.
That's right. All right. So I'm just going to talk about what I call the non-negotiables. These are the most basic things that we found out that everybody's primarily deficient in, but blacks more so. I'm going to relate this to the calcium, salt, and sugar sensitivity that we said before. What you want to be doing is on a daily basis. Everybody say daily basis. This is not once a month or once a year. This should be, and I do this for myself. I use my patients as well. This should be your daily practice to find out how to get this as much as possible. And you'll be shocked what the recommended dietary advice is. You'll be shocked what they're asking you to have in addition. I mean, we're not getting anywhere close to what they're actually recommending for a healthy diet, for a healthy life. They're just saying, okay, just eat fruit and vegetables. You are not going to get enough from your diet alone, I have to say. So I just added these other two again. We're out of time. So So the antidotes, hello sir, the antidotes to the salt sugars, the salt sensitivity, calcium sensitivity are these things. So I started using this, like I told you before, and I want to be very careful when I say this, because I'm a doctor and I've been testing myself. But I was looking for a way to get off my blood pressure medication, and I was using amlodipine. Eventually, I found the right one on Amazon. Again, that's one I can send to you too, the one that I use. You are expected to have 4,700 milligrams of potassium a day.
4,700.
That is the cardiologist's recommendation. I'm sure he's not told you before, but if you go online, test it, ask ChatGPT, ask your recommendation. Potassium is extremely important for the blood vessels and it helps to relax the blood vessels and for the brain. We black people are even more deficient in potassium than white people are, much more. So just for comparison, a banana has about 400 milligrams of potassium. I'm not saying you eat bananas. So you need, sir? The black.
No, banana, just banana.
Banana.
The ripe one, the ripe or the ripe one.
Do you eat unripe ones? No, it's banana. Banana. So banana. That's what has that. So I'm just giving you. Yeah, all right. Please do not. That's really toxic. Have a lot of bad stuff in it. Yes. The eating unripe banana have a lot of may be toxic to you, especially even unripe other things as well, because they've not matured and the enzymes and so on and so forth. It's more healthy to eat the ripe than the unripe, generally. Okay. So again, I just said that just for perspective. You should have about so potassium. I just don't see how you can do that by just on diet by food alone. I just don't see it because you're talking about lots and lots and lots of potassium. You can only find it in vegetables. So you're talking about 5, 7, 10 servings of vegetables a day. Who wants to do that? Who wants to do that, right? I mean, let's be honest with ourselves. Who wants to do that every single day? Zinc is, by the way, very important for men. Very important for men. Why? Does anybody know why?
Zinc.
Tell me why.
The other room.
The other room.
Is that men now?
But more importantly than the other room, prostate. The most zinc is concentrated the most. The organ that concentrates zinc the most is the prostate gland. Very important for prostate health. You go to your urologist. I don't know how many of you have urologists you go to. The ones who treat prostate, men's health. Okay, how many of you has had a urologist tell you to bone up? Forgive the pun, bone up on your zinc. Has any doctor told you bone up on your zinc? No. Double down. Ensure you take zinc. Zinc is important for testosterone. When we say the other room is testosterone, very important for the production of testosterone. But more importantly, how much time do we have, sir?
Keep going. Okay, can we do something?
What?
We will ask questions after your presentation.
Okay.
So just go on, please.
All right. Okay, fine.
Sorry, this is very important. Very important. Gentlemen, please. You treat this sick different from the normal church. Let him finish. He will lose his line of thought. I'm telling you. Let him finish. When he's done, we can do questions. Okay. All right. He's going to lose his line. That's your question. All
right. Thank you, sir. All right. So I'm just pointing on certain things that are very important. I mentioned zinc. So think about you probably haven't heard of vitamin K2. How many of you have heard of vitamin K2? Just one person. So K2 is it's not potassium. People think it's the same thing. So K2 is another of the vitamins. Why I always recommend it is because K2, the number one thing it does is it helps to take calcium out of the blood and then drive it into the bones and the teeth. Remember we said calcium is a problem. Okay. So the number one supplement I recommend is vitamin D, and I'll tell you why. Especially for black people. And now we're entering winter. You're not going to get much from the sun. And the problem is again, like the problem with sugar is that we like sugar a lot, and yet we're the ones who are least likely to handle it. We need the sun a lot, and yet we're the ones who run away from the sun the most. I mean, I've spoken in so many groups now, and I ask the same question: why do black people hate the sun? And you come up with they don't deny it, especially the African Americans. They don't deny it. They just come up with all kinds of excuses and there and there. But that's a different thing for another time. Bottom line is that vitamin D, amongst the things that it does, it helps with the brain, it helps with the immune system, it helps the cardiovascular system, but it also helps raise calcium levels. So as a counterbalance, so to speak, I always recommend that they take K2 along with it. So when the calcium levels rise, the vitamin D will drive it down, and vitamin K2 will drive it down. Not K1. K1 is for clotting. So if you're on any blood thinners, you may have to discuss it with your doctors before you take K2, because sometimes K2 and K1 act alike. But you definitely need K2 to drive it down. Now, if you're in Nigeria, because we can't find it in Nigeria, I just say just take your vitamin D. It's better to have high calcium levels than to die, because a lot of people died during the COVID pandemic because their vitamin D levels were low. That's one of the reasons why blacks died so much, especially in this country. They won't talk about it. In fact, on my YouTube channel, they gave me a strike because I was talking about it so much, even with the Alzheimer's Association. I'm telling you, you guys have to get the information not from your doctors themselves, because everybody is hijacked. For lack of a better word, everybody has been hijacked. I don't know how to say it any different than that. I was given all my time traveling everywhere with the Alzheimer's Association. And I was focused on blacks, and I was saying vitamin D, vitamin D. They called me and told me to warn me against talking about vitamin D. And yet vitamin D is probably the most important nutrient for your brain. And the same Alzheimer's Association came out with a study that showed that you can reduce your risk of dementia by 40%. Wow. If you have enough vitamin D in your body, if you have optimal levels. And that's the same Alzheimer's Association that told me to stop talking about vitamin D. So, I mean, I don't want to use the word conspiracy, but I'm just trying to point out that, I mean, especially those of you who are very privileged to have maybe top tier doctors and all that. I've worked with the people at Johns Hopkins as well. They are against supplements. They don't care what, don't talk about it. So I need you to pay attention, special attention. The fact that you have access to the best medical care does not mean you're getting the best medical care. All right. So let me just move on real quick. So this is you see Alzheimer's Association here. This is the study I talked about conclusively that you can prevent Alzheimer's disease by 40%. It's not the only thing. Don't get it wrong. It's not the only thing. There are lots of other things you need to do, especially for a black person. Like we said, we mentioned the other supplements as well, right? But it's a very good place to start. You've read this, right? Okay, so deficiency, we now know that, I'm just going to point to, it helps with blood flow. Vitamin D is very important for blood flow. Like I said, I started taking potassium and calcium and magnesium. I also took vitamin D and K2. I'm able to control my blood pressure. It used to be high before I got on my, again, I'm a doctor. Everybody should have a blood pressure measurement. Does everybody have one at home? You must have one at home so you can check it, because you never know when this thing is going to go up. You may get stressed, you may not sleep well, whatever. The thing goes up and then you think that everything is okay. Again, we black people are more prone to these problems like strokes and those things. So you have to control that. If you have the possibility to have your blood sugar, some people have the continuous glucose measuring thing, you can do that as well. Very important again for black people. This is the range of vitamin D levels you should have in your blood. I talk to people, they say the doctor checked the vitamin D and they say it's okay. Sometimes that could be like 30. Are you going to tell me that that's okay? Are you going to be satisfied with just 30 just because it's within the range? Many doctors are saying that they don't accept anything more than 100. I know doctors who treat patients with insomnia and sleeping problems, they don't accept. They say it's only when they get past 70 that those sleeping problems have subside or they improve upon them. Some people with these ladies with menopause. By the way, women have twice the risk of dementia as men do. I hope you know that. Twice, yes. One of the problems is their menopause. Menopause. When it comes to menopause, things crash, for lack of a better word, including estrogen and testosterone and those things. But also vitamin D levels will go down as well. And they said it's only when they pass 60 or 70 that they start improving their symptoms. Again, vitamin D is not the only thing. I checked mine. I was 83 at one time, but I do a lot. I take like 20,000, 30,000 a day. I mean, I pop it like it's going out of style. You do 10. That's impressive. You do 10? That's really good. What got you to 10,000? 10,000 I use. Okay. Yes. And the older you are, the more you need. The older you are, the more you need. The bigger you are, the more you need. The darker you are. I can see dark lights in this first row. You, Mr. Man, wearing the kind of camera, you probably will need more than these two. So darkness, so dark skin is a problem because why? Does everyone understand what I just said? Why I said that? Correct. Exactly. It blocks out the rays that you need to make vitamin D. It blocks out. All right. Okay. So a white person can go out in the sun. So we're talking about. So the recommendation, by the way, is 800 international units. That's what the recommendation is. That you should be having. They'll get apoplectic if you're not talking about anything more than 1,000 or 2,000. That's what the typical doctor will shout. They say because the CDC recommends 800. Okay. Now, if you're a white person, this is what they found out. Goes out in the sun for 30 minutes, they'll make this. Okay. For a black person, that's why I had this picture here. A black person will probably have to spend like 6 to 10 times that long to get that same amount of vitamin D. But my whole point is this. If your body makes 10 to 20,000 on its own, and in fact, they've done tests. What they call those Baywatch people? Lifeguards. Mm-hmm. They've done tests on them. They've seen as much as 50,000 they've made in the course of a day of vitamin D. So the big question is, if your body is smart enough to make that amount, why is there a recommendation that you should not take more than 800? Who came up with this? Who's the genius that came up with this recommendation? Clearly, he was not looking at black people. Because we are by far the most deficient. I hope you realize that by now. Yes. By far the most deficient. So if you need something for your brain and you're deficient in it and nobody's telling you to take it, or they're blocking people like me from telling you to take it, then we have a problem. All right, so this is the last thing on vitamin D. Brand new pups, after 8 months, what they did was that they prevented one of them from being able to make vitamin D. So after 3 to 5 months, you can see the difference. Which of them do you think they blocked? Weaker, older, and all that. All right. So what can you do? Let me just quickly give you the steps that I think everybody should be taking. Please take your medications. As you know, I've not said anything about. I just told you about my own experience. But please take your medications. Make sure that your blood levels are normal. There are about 7 tests that I always recommend. That'll probably be in another talk or whatever it is. I mean, I do have a YouTube channel. I talk about these things. You can find out about that. Start purposely reducing please, you don't really need to eat as much as you usually do. And especially the carbs. You want to reduce your carbs. You want to take more proteins. We're now beginning to find out about red meat is not as bad as people have said it is. Red meat is not. In fact, if you ask GPT, this is GPT. So I asked ChatGPT, I said, what is the most nutritious food on the planet? And you know these things they are programmed by by people, by white people. They are not entirely objective, even though they've got terabytes of information. So what did he give me? Kale. What's that one again? Spinach. Yeah, exactly. All those things. So he gave me all those things. Broccoli. That's what I was looking for. So he gave me those things, and then I now wrote back into it. I said, "You know that's not true. You've omitted beef. Now, give me another list of the top 10 and include beef in it." It apologized, as it should, and then he gave me a new list. Where do you think beef was? Number one. Oh, wow. Beef has all the nutrients, the most bioavailable. So it's not just enough to have it in the plant. And they're now beginning to see problems with this vegetarian diet and the vegan diet.